Greetings. Let us learn about the endoscopic findings that we see in the small intestine. So now the endoscope is just at the pylorus and peeping into the duodenum, and this is the classic appearance of a normal duodenal bulb, which is relatively featureless. What I mean by that is the duodenum does not have any folds that is typically seen, circular folds typically seen in the second portion of the duodenum onwards. So keep this thing in mind. And one of the commonest pathologies that we encounter in the duodenum is an ulcer, most often seen in the first portion of the duodenum or the duodenal bulb. Here you see a clean based benign duodenal ulcer on the anterior wall of the duodenum. Ulcers in the anterior wall of the duodenum, if untreated, are at risk for perforation, while ulcers in the posterior and inferior wall of the duodenum are more likely to bleed. This is a typical appearance of a submucosal tumor, and the most common cause for submucosal tumor in the duodenal bulb is a carcinoid tumor. Compared to the normal appearance that we have seen so far, here is duodenal cancer with destruction of the mucosa. The lumen became smaller and there is ulceration, friability, as you can see here, and with a narrow lumen. Unlike gastric cancer, duodenal cancer is extremely rare. So when we go from the duodenum into the second portion of the duodenum, as you can see here, this is the second portion of the duodenum. Most often, the second portion of the duodenum looks normal with circular folds, and that's where you take biopsies from the second and third portion of the duodenum if you have a patient with either iron deficiency anemia or malabsorption to look for celiac disease or any other infections in this of the small intestine like a giardiasis, etc. So here in the second portion of the duodenum, it is characterized by circular folds, unlike the first portion of the duodenum. This is a flat polyp or flat adenoma arising in the second portion of the duodenum. Here is one flat adenoma. There is another flat adenoma here, another flat adenoma here, and another flat adenoma here. On this picture, you see a lot of small flat adenomas along with a big adenoma here, and this is typically seen in patients with familial adenomatous polyposis. You could also see submucosal bulges with a bluish hue, as you can see here. This is an ectopic varix seen in patients with portal hypertension. Similar to the varices in the esophagus with high risk findings of bleeding like cherry red spots and red wale sign, you could see sometimes the same findings in the duodenum. Here is a varix with high risk features for bleeding. in the second portion of the duodenum. As you go further down, you see the third portion of the duodenum. Again, similar to what you see in the second portion, circular folds. And it's always important to look into the third portion of the duodenum in any patient coming in with melena, especially if they've had abdominal aortic aneurysm repair, because that is the area where they can have the first sign of bleeding. We have seen in the anatomy slides that the aorta is behind the third portion of the duodenum, and if the graft gets infected, it can erode into the third portion of the duodenum, and you could see signs of bleeding in the third portion of the duodenum. I hope this is useful. Thank you.